Hi and welcome to Medcity's Secret Mantra to OET. In this video, we are going to discuss the speaking subtest of OET. I've done a couple of videos on speaking and there were certain comments that came up, which is why I thought why not make our upcoming video on how to start a roll card, how to start a conversation in OET speaking. So that's exactly what I'm going to discuss today, right now. How do you start a conversation? I'm sure some of you would have learned, let's say, a preset way of beginning a conversation. And because your role is a nurse and you're going to talk to probably your patient or your patient's bystander, you would have in mind created a structure or a format or a method to begin the conversation you have. We all know that in OET speaking, unlike any other speaking test of any other international assessment, it's a role play that has to be enacted and the conversation, the role play has to be initiated by the candidate. So here the candidate is a nurse. In all the other exams, it's the examiner who will ask you questions and you just have to answer them. But here, it's the candidate who has to start or initiate the conversation. That itself becomes a challenging factor because it's always much easier to respond with an answer than take the lead and begin the conversation. So let's see how we can begin an OET roll card in different contexts, in different settings, and what are the various ways to initiate the conversation. Let me first begin with the most commonly used cliched way of beginning the conversation. What most students feel really comfortable about is introducing themselves. So no matter what the context is, no matter who you're talking to, no matter what the situation is, all of you tend to be inclined towards this particular way of starting the conversation, which is, "Good morning, my name is Sangeetha Gopi. I'm one of the registered nurses working in this hospital. How may I help you today?" Now, this is the easiest way to begin a conversation, and because it's quite easy to learn and because it's easy to memorize and it's easy to reproduce and recreate, many students feel why not begin every conversation using this or these kind of sentences. Well, I wouldn't say this is wrong, but the only problem is, will such an opening, will such a way to initiate the conversation match every setting or match every context? The answer is no, it doesn't. Imagine you're going to meet a patient in his or her house. Probably it's to demonstrate, it might be to give information, it might be to collect information. Whatever the reason be, you are visiting the patient in his or her home. This way to start the conversation does not suit the setting, which is a home visit. Of course, if your patient is admitted in the hospital and this is your first visit to the patient, then such a beginning definitely makes sense because it's ideal to introduce yourself, let the patient know who you are and why are you here today. So that would be an ideal way to begin if your patient is admitted in the hospital, probably a general ward or any other ward, but not an emergency ward. And then you begin your conversation. So that's absolutely okay. But in case of a home visit, in case of probably a community health center, in case your setting is a school, in case your setting is a nursing agency or an emergency ward, such a way of beginning will not be really apt. So let us look at some of the roll cards that I would like to discuss today and see how we can start a conversation. Not only does the setting and the description of the patient or the background of the patient will really help you to begin the conversation, but also the first task at times will help you trigger the conversation. So let's look what they are. So this is the first card I have on screen and the setting is a hospital ward. So what is the background information of your patient? It says, you are the head nurse at the hospital where Suzanne's husband has undergone a hip surgery. She is very worried about her husband and is concerned about his recovery process and the fact that he is a blood sugar patient. This is an interesting thing because see, the patient here is Suzanne's husband, which is a male, so you would be addressing him as he or him, but you're going to talk to Suzanne here, which is a female. So Suzanne is a female, she's a female, so you will have to use pronouns like you probably when you talk to her, but you will not use she. So gender confusion could be an issue here. So this is a tip that I can give you. Be very clear who your patient is and who you're actually addressing the conversation. Now your patient could be male, but you might be talking to the female partner of the patient, or your patient could be a child and you might be having the conversation with the mother, or your patient could be a child and you would be having the conversation with the child itself. So there are different scenarios possible. So be very clear as to who you're talking to. In this case, because Susan's husband has already undergone hip surgery, the possibility is high that as a nurse, I've met the patient before, and probably I've also met Susan before because the patient has already undergone a hip surgery, right? So it could be a few days or just one day after the surgery. So in such situations, you can begin your conversation showing the relation you already have with the patient or the patient's bystander. Here I can begin with a very friendly gesture or an expression to show that I am already friends with Suzanne, who is the wife of the patient. So probably I can say, "Hi Suzanne, you're looking much relieved. I'm sure it's because your husband's surgery has gone well. I'm here to talk to you about the surgery. Do you think it's the right time to have a word with you?" Wouldn't that be an interesting start? Because it definitely shows that you're already friends with Suzanne. You know her husband has undergone a surgery and it's already positive, that is, the surgery was successful, but there are certain things you'd like to discuss with the wife. So that connects the person you're talking to. So it's building a relation. So you've clearly conveyed the message or the information that I'm familiar with my patient. So that is a good way to start a conversation, or I can say another good way to start the conversation. This is in addition to the first example I'd given you at the beginning of the video. Let me show you another role card. Okay, well, here the place or the setting is the patient's house. So what is the background of the patient? So I am a district nurse and the patient's family doctor at the hospital has asked me to go to the patient's house to teach him or her about how to give themselves insulin injections. This clearly means I'm here to demonstrate or show my patient, to guide my patient and to empower my patient on using insulin injections. And I am a district nurse. So I am visiting my patient at his or her house. It says the patient is worried as he or she doesn't understand why it's necessary for him or her to start insulin injections, as he or she thinks that he or she is able to manage diabetes perfectly with diet and tablets. Okay, so you know you're here for a reason, but because you're there for the first time at the patient's house, it makes it more sensible to introduce yourself, and it makes even more sensible to ensure that you're visiting the right patient at the right house. So it's better to cross-check the address and the name of the patient before introducing yourself, or even before starting your conversation, as into getting started with describing or demonstrating how to use insulin injections. So in such situations, probably I can say, "Hello, I'm Sangeetha. I'm here to see Mr. John. is this his house? And probably I can read an address and say, is this Mr. John's house, street number 22, flat 58? So I'm cross checking, am I at the right doorstep? So then if my interlocutor says yes, you can say, may I come in? I'm the district nurse and I'm here to talk to him about the usage of insulin injections. Okay, so you're taking permission to enter the house. So this is a very different beginning from what we discussed earlier. So you can say how you can tailor make your starting sentences of a conversation depending on the setting. And it also makes perfect sense to believe in the idea that there is no cliched way to begin and there is no way you can memorize a particular way to start a conversation. You can at best practice different settings, practice different scenarios, practice different ways to start a conversation, and be in such a state that whatever task card or a role card you get on the day of the test, you've done that before, or probably even if it is new, you are well prepared to start a conversation. So you don't always have to fall back on your previous experience or practice. But such regular practice sessions will make you confident and ensure that on the day of the test, no matter what the role card is, you'll still be able to start a fresh start or give a fresh start to your conversation. Let's have a look at another role card. Okay, so this is a children's hospital ward. So that is the setting. And the nurse, my patient is a young boy aged 4 and he was admitted to hospital through the children's emergency department for acute meningoencephalitis as a result of complication following mumps. Okay, he has fully recovered and is ready to be discharged home. His parents are unaware that a vaccine is available in Australia which protects against mumps. They would like further information and guidance regarding vaccination for mumps. They also have a 2-year-old son and have only lived in Australia for 6 months. Okay, so here your patient is a young boy aged 4, but here you're trying to convince his parents, probably empower his parents and help them be aware of the child's situation and how they can further manage the child. Yeah. So his parents are unaware that a vaccine is available and probably even giving information about how such vaccines can be taken, especially for the other child who's 2-year-old, so that they can ensure that their second child does not have the same problems as their first child. So here if you're a little confused as to how to begin your conversation. Now we know for a fact that the child is already in hospital. We know that the child has been admitted in an emergency department and the child has had a kind of, what do you say for acute? Okay, he has recovered. So that shows he was in hospital for maybe a short period of time. So during that particular time frame when the child was in hospital, it's highly possible that the nurse would already have had some kind of conversation with the boy or the boy's parents. Now here the task says explain to the parent that the boy has fully recovered. So that is your hint on how to start the conversation. If you're talking to the mother, you can say, hi Mrs. James, your boy is really strong and he's doing really well. You can be relieved that he is well off right now. Okay, so here I'm not introducing myself, which clearly shows or conveys the idea that I've met you before, that I know the patient's condition. So I'm connecting it to the patient's condition, saying that your child is really strong, he's just had an operation or undergone a surgery, but he's doing really well and he's well off the danger mark. So there's a lot of information that is being conveyed in that particular sentence. So that I've done with using the first task at hand, which is that the boy has fully recovered. So in a different way I'm conveying the idea that he is now alright, or he is now safe or away from the danger situation. So, there is not a lot that the parent has to worry about right now, because whatever danger is or whatever thing of worry is already over, right. So, the patient is recovering well. So, that is a piece of encouragement, a news that will definitely give a lot of strength to the parent. So, that is a way I can begin by conveying the positive news that the child has fully recovered. Here I am not using my name to introduce myself, but I am addressing the parent by the name. So, I say, hi Mrs. James. Okay. Now, in such settings it would not be right if I was to begin, good afternoon, my name is Sangeetha Gopi, how may I address you? Now, that would be a very wrong beginning. Or even if I say, good afternoon, my name is Sangeetha, I am one of the registered nurses in this hospital. I will be looking after your child today. How can you help me? You look very worried. Can you tell me what is the reason for your worry? All such cliched beginnings is something that you can avoid in this situation. So, see how even the first task will help you initiate the conversation. So, you can always think of starting fresh or starting in fresh ways, in different ways. You do not have to stick to one particular way to begin a conversation. So, let us have a look at another role card. Okay. Now, this is an interesting card because the setting is a community health clinic and I am a community nurse, and who is my patient or whom am I addressing to? It is a young woman and she is a mother of 3 children. Their ages are 3, 4 and 6. She has come to the clinic and tells you she has just discovered her eldest daughter has head lice. She is upset and embarrassed and assures you she always washes the children's hair regularly. She has no experience in dealing with the situation as it has never happened before. So, you know you are going to deal with a highly insecure young mother who has 3 children. So, her hands are full looking after these 3 who are quite young, okay, and she is upset and embarrassed. So, we need to begin in a way that we do not further embarrass the young parent. So, how do we begin? So, if you are really not sure of okay, what should the conversation begin with, because she is visiting a community health clinic, so there is no way that I know the patient beforehand. This is the first visit of this parent to the hospital or to the community center. So, I am meeting this patient for the first time. So, definitely introduction makes sense. So, it is always better to start off with an introduction, but it is always advisable to also look at the first task at hand. It says, reassure the mother and explain that head lice is contagious and anyone, no matter how regularly they wash their hair, can have head lice. So, this is the idea to reassure the mother that the mother is not at fault. It is not because the mother is not looking after her children properly that this happened, but in young children, head lice, which is quite contagious or communicable, is bound to happen, especially because you are all school going children. So, that is how you can reassure the mother. But again, you cannot just start saying, oh, I know your children have head lice, do not worry, this is quite common, though head lice is contagious, I can tell you certain methods to contain it. Do not start your conversation that way because you do not know the patient. Though you are given the background information, this is something you have to collect from the patient during your conversation. Okay, so how do I begin my conversation if I am the community nurse? I would say, good morning, my name is Sangeetha, how may I help you? Or I can say, good morning, my name is Sangeetha, please have a seat. You look really worried today. Is there something that's bothering you? Okay. So, 2 different ways that I showed you how you can have a conversation. Here the prominence is in introducing myself because I am meeting the patient for the first time. So, I really do not have an idea of what is wrong with the patient. And then I let the patient tell me her problems, and I know from the task that the patient is supposed to be upset and embarrassed. So, I have to reassure saying, I perfectly understand what you're going through, but trust me, this is something all mothers go through or face. I have had numerous such situations or cases where parents have come and spoken to me about it. So you're not the first case. So relax. As a mother, I'm sure you're doing a brilliant job. Let me help you further with this. So that's how I can connect it once a parent tells me what her problem is. And this becomes highly encouraging and reassuring because I'm connecting it to the fact that head lice is very common, and I've had previous cases of parents coming to me for advice and help, and this is something the mother is not to be blamed for. So this is the way I can reassure the parent. So though the task says reassure the parent, I cannot begin with reassuring because I'm meeting the patient for the first time. So I need to introduce myself, I need to ask what her problem is, I can ask what her name is and how should I address her, and then I elicit the idea from her, I elicit her problems from her, and then I go on to the first task, which is reassuring the parent. So these are different ways in which you can have or start a conversation. If you've noticed, these are not cliched ways of beginning, and you cannot have any of these ways of beginning a conversation prepared way ahead, because you have to wait on the day of the test. What is the card that you get, and only depending on the card that you get can you decide on how to begin the conversation. And trust me, during the first 3 minutes of your preparation, after which you have to start the roll card, the only thing that you can be well prepared is how to begin the conversation, because you already have the roll card in hand. And once you start the conversation, how the whole conversation progresses further completely depends on the interlocutor also. So depending on their response, only can you retort, right? So that's all in this video. We were focusing on how you can start conversation with different settings, when you're talking to different patients, and if at all possible, even by using the first task given the roll card. I hope this video is really useful and helpful to many of you out there. Keep commenting on all our videos so that we can help you further, and good luck with your practice sessions. Thank you for watching the video.